experimenting right now with AI, and I would love, like to kind of like do it, like with you.
Mhm.
So we kind of like helping, like people who doesn't have, like enough money or like resources, like to go to the doctor, but we trying to kind of like teaching them to use the today's tools like AI to
Mhm.
help them navigate, like their like a health journey. But of
Mhm.
course, like even if you kind of consult with your AI coach, you need to have like a real doctor, like to talk to. But
Mhm.
then, like I want to like run, like kind of quick experiment with you and like maybe like share the screen. And maybe like we can I can ask, like Chat GPT right now, like what the checkups and panel you can recommend to prevent the heart risk.
Yeah.
And it will give us the answer. And maybe
Yeah.
like you can comment on that. That would be
Sure.
really great.
Sure. Yes, absolutely.
Let me just open it up. It would be very, very interesting.
And just as you're doing that on the topic of AI, so I do use medical AI actually in my medical practice, and it has been very much additive to my practice, especially when I'm working with patients who may have more complex diagnoses or where I'm really searching up some very, very specific evidence. To have that at your fingertips and to have those reviews, and again, from a medical AI, as a physician, of course, because then I can vet it, I understand the nuance and whatnot, but it really has been so hugely additive to my practice for certain cases.
Mm-hmm. What blood panel and tests, right? And
Mhm.
uh, mm, uh, I should do to prevent the heart attack. I'm just going to share the screen. And you know how the chat GPT works by writing the good prompt. But of course, when you doctor, you can actually modify prompt much better because you have like this medical background. So I want to like show people like how like it's also important to be mindful of the prompt. So let's press and see what it says.
Yes.
So
Good.
yeah,
Excellent.
so
Good
let's
job.
comment on this. Let's pretend that, I don't have money to go to the expensive doctor. So how I can help myself and how we can modify the prompt, maybe like to get the better result, or maybe it's good enough.
Yeah, yeah, good question. So yeah, and I would just, preface it by saying, great to get started with some information. And I do have, patients that'll come in and they've already you know, done some research through ChatGPT. And I think it is helpful to come in with that information to a doctor, but I still would vet it
Mhm.
through a healthcare professional, of course, and make
Yes.
sure that that applies to you. But yes, lipid panel. So this is what we talked about: fasting glucose and hemoglobin A1C. We talked about high sensitivity CRP. We talked about complete blood count and comprehensive metabolic panel. These are standard labs that we always do with preventative panels. So absolutely agreed. And then ApoB and LP little a, we talked about that as well. Some of the other ones that I said specifically, there are other markers that I didn't mention. Those are exactly the ones listed here. So LDL particle number and size, smaller LDLs confer a higher risk. Oxidized LDL, again, another measure of that oxidative damage and oxidative stress.
Mm-hmm.
Homocysteine. So again, high homocysteine has been associated with higher risk of cardiovascular disease. And it's a marker that can be high due to a functional deficiency in vitamin B12 and folate. So this is usually part of the labs that I check. And then fibrinogen, it's a clotting risk marker that I don't actually routinely check in my practice, but yes, that is another marker.
Mm-hmm.
And then some of the ones, IL-6 and myeloperoxidase, other oxidative stress markers that can be checked as well. And again, some of these I don't do on a routine basis. Some of the endothelial ones, I don't do these ones, but they're talking about nitric. Nitric oxide is very important in terms of blood vessel support and blood flow. we talked about insulin, fasting blood glucose, and then calculating that insulin resistance index. Cortisol levels. So again, may not apply to everyone, but I may get cortisol levels either throughout the day or just morning cortisol, depending on, again, what I'm looking for. Thyroid panel, we absolutely always check a thyroid panel during preventative care, because thyroid disease, both hyperthyroidism and hypothyroidism, so underactive and overactive thyroid, can have implications for cardiovascular disease. And then sex hormones, again, in specific patients, based on symptoms and so on, we may check that too. In terms of, so some of these other LPPLA2, I do check as part of my comprehensive lipid panel. D-dimer, I don't check routinely, or the platelet function test, not routinely. ApoE genotype, so in people who are interested in assessing their genetics, or people with a history of Alzheimer's in their family, we may check that, or we may do a genetic test that checks that as part of that. MTHFR mutation, this is a whole other topic, but if I see a very elevated homocysteine, again, MTHFR, I know this may play a role, but many people in the population have 1 or 2 MTHFR mutations, and so this is a whole other topic that again is too lengthy to go into now. And then in terms of imaging, so these are exactly some of the things mentioned: coronary calcium score, carotid ultrasound, and then again echocardiogram, EKG. Again, if we're looking for something specific. Coronary angiography, again, this is actually if we're, to look at the specific plaque, and then some of the other tests as well for blood vessel function.
So would you rate this list as pretty decent, or, like it's too much, or?
Some of it, I think, is, again, it's very person specific, and some providers check a lot less, some check a lot more. I would say that, again, I very much tailor the test to the individual. And then I also integrate the guidelines and do some additional tests that I think are going to be actionable and give us that information. So I do think that some of these I don't do routinely, and I think might not be applicable certainly to everyone. But it depends, if one does, let's say, this kind of a search, and then they go to their doctor and say, okay, well, which ones of these apply to me? That would kind of be, rather than going in and like, I have to have everything on this list. That would absolutely not make sense.
Unless they have money and they can just like, oh, I can do all of this.
Yeah.
Yeah. So, how would you, like to get like maybe like the better answer, how would you modify the prompt? Like, would you ask it like something differently, or how would you like make it
So
like
again,
more specific?
Good question. Yeah. And maybe we'll kind of end it on this note. So what I would do again is just being very cautious not to obviously get medical advice from AI, just because we're not there yet. And obviously it's really, really important for anybody having any medical concerns to really talk to a qualified professional. But if we want to narrow things down and get more specific and get a little bit more individualized information, what I would do, for instance, if I have let's say if I'm working with someone who may have a complex diagnosis, what I would enter into my medical AI would be their age, their other chronic conditions. Maybe I would enter family history. I would enter information that, as a clinician, I think would help the algorithm really prioritize and narrow things down. But then again, this is myself with my clinician hat, whereas somebody who may not have the medical training doesn't know this is relevant, this is not relevant, I should mention this, I should not mention that. So that gets a little bit tricky, because again, you don't want to use it as medical advice, but if you're using it as a starting point of like, oh, I'll go to my doctor with this and see what they think, I would say try to kind of narrow it down, make it specific, and then still talk to a trusted provider to see what they think.